playing with a few things to see if I can get my picture to come up.
Okay. Well, why don't we start, because it's 1:34 and stuff.
Okay.
So why don't we start by doing introductions? So maybe why don't you start, just do a real brief introduction with yourself, Sonia, and then we'll move to the next one before your presentation.
Okay, for sure. Okay. My name is Sonia Kodolak, and I hope that there's not a big echo in here. I'm actually sitting in the surgery room.
There's a little bit of an echo, but that's
Okay.
that's where you got to be. So
I can go in another room, but there might be a little bit of distraction, that's all.
I think it's okay. Everybody can hear Sonia? Thumbs up. Okay, good. Yep, we're good.
Okay. So my name is Sonia Kodolak, and I work at the Lake Bonivista Animal Clinic. I am a registered veterinary technician here. I've been doing my job for 16 years now. I enjoy it. I love working with the animals. I love the people I work with, the whole environment of it all. I took my training at Lakeland College in Vermilion, Alberta. It's a 2-year program. There are 3 schools in Alberta to take the program. There is one in Olds, Fairview, and Vermilion. There are schools in other provinces as well that you could go to that have the course as well. There's 3 different branches that I've learned that you can go into if you're not wanting to to be a technician. There is a shorter course, which is a 4-month course at Olds College. I don't know about the other colleges yet. I haven't looked into that, but I do know at Olds there's a 4-month course, and it's for a technician assistant, so it would be my assistant. I believe it helps you train to hold animals and just basic knowledge in the clinic. There's also another course that's only a year, and it's called the Veterinary Office Assistant course. And that one will teach you just a little bit more advanced working in the clinic, and just a little bit more talking to clients, more handling techniques, just a little bit more in depth. And then there's the course that I took, the registered veterinary technologist, or otherwise known as an animal health technologist. And then the next higher up would be a veterinarian. So I graduated in 2001, and sorry, I'm switching my pages. I do have a speech. While I was going to school, I did some part-time work at the SPCA in Lloydminster, which is another job, like when you're a technician or tech assistant. You can work at shelters if that's something that you like to do to help the animals in need. There also are, with the animal health technology course, there's so many aspects that you can go into, like different branches. You can work with companion animals or large animals, exotics, anything that pretty much there's so many options out there that you can go into. After I graduated from tech school, I worked in a pig barn. I did that for just a little bit less than a year, and it was a farrow to finish barn, which we worked with little piglets all the way up to finishing as going to your freezer. It would be the way to put it. So that was a really big learning curve for me because you got to see them when they were born all the way to when they were bred. It's quite the process to see. And then I got into a clinic, and that's where my passion is. I love working in the veterinary field and with the veterinarians and as a technician. My day when I come into the clinic, my day starts off with getting prepared for the animals that are going to come in for surgery. So we would do a consent form for any kind of surgery for animals because they need to, the owner, there's always a risk when animals go under an anesthetic. And so we get the consent forms ready, and the animal gets brought in, and we take blood work from them. So I take the blood and I do the analysis on the lab machines. The blood work will just tell how the kidney function and liver function, and if there's any clotting disorders in their blood. So there's a lot of information on that blood screen that we do before an animal goes under an anesthetic. Then I would start to prep the surgery room, and I set up the table with a heating pad so that the animals stay warm when they're in the surgery room, because when animals go under an anesthetic, their body temperature just naturally drops. So we want to try to keep them warm. So we have a heating pad to keep them warm. And then I get the surgical pack ready for the doctor, depending what surgery they're doing, what instruments need to be put in out for that doctor. And depending on the size of the animal, whether it's a cat or a dog, the type of suture that they're going to use to stitch up. If they're doing a spay or a neuter, we have to have the right suture to stitch them up with. And then I'm the person who will prep the animal for the surgery. And then I'm the one who monitors the animal. So when the animal's under anesthetic, I have to make sure that they're breathing properly and that their heart rate is staying stable and the blood pressure is stable as well. I watch the fluids to make sure that the fluids are going in at the right proper rate. This all gets set up before the animal goes under an anesthetic. All the fluids and the machines all set up in the surgery room so that we can keep a close eye on the animal. And when the animal wakes up from the anesthetic, then I'm still monitoring that animal with a stethoscope and listening to the heart and the lungs before they get extubated. And what that means is the tube that comes out of their trachea that helps them breathe, that goes into from their tracheas to help them breathe in their lungs. Once they're awake, my job is not done yet. I am still watching them to make sure that they're waking up peaceful. Some animals will wake up and I guess we would say they thrash, so they would be I guess kind of flipping around would be another word for it. They're very scared. They don't know what has happened. So we try to keep them calm, and that's my job, to keep them calm or give them any kind of medication for them if I need to keep them that way. And then their temperature after surgery, to make sure that their body temperature is going back up, because as I said, when they're under an anesthetic, their body temperature goes down. So, and then And then cleaning up afterwards, washing the instruments, getting the packs ready for the doctor the next day. So that would be sterilizing them as well. And I help out with the receptionist up front as well. So I do answer phones and talk to clients. I talk to them about specific foods or diets for their pets if they need. I do enjoy that a lot as well. Most of the clients that come in are very compliant. They will do whatever we tell them that their dog needs to help them. But I enjoy that. With being with the job for 16 years, you can see I really love my job. And that's pretty much what my day is for taking care of the animals and getting them ready for surgery. I also do like just routine blood work if an animal comes in and they just need some blood work because it's been a few years and we just want to make sure there's no underlying problems aboard that we can't see on a physical exam. So I'm the one who takes the blood as well and analyzes it. We do urinalysis as well. The technicians, we do that as well. So analyzing for different, for infection or for kidney function. There's many different things that you can tell from a urinalysis in a pet. And that's part of a hazard as well in the field. You can't be worried about getting dirty because sometimes you'll have a pet pee and you still have to hang on to them for the veterinarian, or they get scared and they might poop, and then you still have to hold on. You can't let go because they're just scared. They can't understand why we're making them sit in a certain way. I also, as part of my job, is also to place the catheter into the dog's vein, so that we inject drugs into it when we are just about to place the endotracheal tube for them to breathe during surgery. So that's another part of my job. Sometimes it can be tough. Those veins can move a lot, can make it a little bit interesting. I kind of jumped through my thing all over the place. I do apologize. Let's see here. If anybody does have any questions, please just stop me and I will answer that.
Hey, Sonia, with like you're in a smaller clinic and stuff as well. Some of the clinics, there might be, 4 or 5 staff up front, but you're actually a technician. Does that mean more schooling than the other people that would be out front that are just bringing, people in and, registering the dog or signing out or doing the cash or,
Yes, I have more training than them. A lot of the receptionists up front would be taking the veterinary office assistant course. So that's the 1-year course where they would be able to talk to they would learn to talk to the clients and answering phones and basic handling. Maybe a little bit more advanced than the 4-month course that they have now for technician assistant. So yes, I do have more training than the front end, but there's also, we have a veterinary student right now that is off. She goes to school in Australia, so she's having her summer off right now. So she she's a veterinary student, so she has some training and she's doing our reception right now.
Okay. Now, is that schooling done through the same place as the other one?
No, she's going to Australia to be a veterinarian.
No, I mean, when you want to be just the veterinary, what was it?
Offices?
Office assistant, is that done through the same place here in Alberta?
Yes,
Those three
yes,
places that you mentioned?
yes, yes, they are. Uh, in Olds and Fairview and Lakeland College in Vermilion. Yeah, they all offer that course.
Do they offer that course at Nate as well?
I believe that's Fairview.
Oh, okay.
Yeah, yeah.
Or sorry, you said Lakeland, Olds,
And Fairview.
Nate, and Fairview. Okay.
Yeah,
Yeah.
yeah, yeah. So they have all that at those three schools. And I don't know if I met anybody from Fairview before, but yeah, the other people that went to Olds and I myself at Vermilion, we really enjoyed our courses. I found it a lot of fun. We worked with all the animals. We at Lakeland College we had a farm on campus, so we could work with the large animals, and there was also a small animal practice on campus as well. So we could work with some of the farmers' animals that they would bring in.
So if somebody wanted to get into this field of work, do you have any suggestions for them as to maybe the steps that they would take? Like, would it be volunteering with a vet clinic to start with, or?
Yes, it all starts with volunteer. That's where we all start. For tech school, you need, I think it is 100, before I believe it was 175 hours of volunteer work. And that's just because they want to know that that's what you want to do. So it is best to also do volunteer work. I went to school with a girl that realized when she was in tech school that she couldn't handle blood. So every time she collected blood, she fainted. So that's one thing you will have to be able to see is blood, and there is a lot of sad things that we see as well. There will be animals that a little, and it's not as bad for us as the SPCA is. But from myself working at an SPCA, it's been sad, but there is a lot of neglect out there. So you have to be able to see animals in not a very nice shape.
Okay.
But it still is very rewarding though at the end of the day to help an animal.
Cool.
Mm-hmm.
We actually didn't do introductions before, so what, Emma, you want to start with yourself? Maybe who you are, and maybe why you're looking at this career, or?
Yeah, so I'm Emma. I'm Renata's daughter. I have a couple friends who actually went to Lakeland as well, and they really enjoy it. I've always really loved animals. I ride horses. So I've seen like a lot of vets and stuff. Like I've worked with a lot of vets just through that, and I think it's pretty cool. So I'd definitely like to start off with some kind of volunteering or something and then see.
Cool.
Mm-hmm.
Thanks. Jasmine?
And oh, sorry.
Sorry, go ahead, Sonia.
Oh no, I was just gonna say, with liking horses, it's probably also a good place to taught. Like there are a few places that take volunteers for horses. Like there is a vet
Delaney?
clinic in High River that takes a lot of volunteers. We've sent a few there.
Yeah, I know Delaney's vet clinic, which is out by Stony Plain. She was our vet for a long time where I used to board my horses. So I know that she has a volunteer program. So that's something I'd look into for sure.
Yeah, it's always a good place to start.
Yeah.
Yeah. No, good for you.
Okay, Jasmine.
I'm Jasmine. I'm new to Gateway, and so I'm just attending to see what these workshops are all about.
Cool.
Good to see.
Hey.
And is it Zach?
Hey guys, I'm Zach. Just I kind of wanted to change that name. I get called that by my family, so
Okay.
I'm the same as Jasmine. I'm just here to, learn about the animal care and just hopefully get a job into it, hopefully, or just volunteer for it.
Great.
Mm-hmm.
And this says Gateway on the other one, so.
I'm Michael, and I'm a career and inclusion consultant with Gateway Association, and I work with job seekers. So I know a lot of times a lot of our job seekers are interested in this field. So I want to learn about it so I can help them navigate what to do and who to contact and the schools they go to. So this is really great information today. Thank you, Sonia.
Oh, you're welcome.
And then Ashton.
Hey, I'm Ashton. I'm also an inclusion consultant and career consultant with Gateway, but I also do some work with Mentorability. But today I'm attending for a couple of participants that I work with who are interested in this field. And I just needed a bit of a refresher as well, because I know it's such a common interest of our participants is working with animals, but I think they often see the fun side of it and not the hard work that needs to go into it, or like the hard moments, or even just the fact that you need to do some volunteer work and get some experience with animals first. So it's good to have that refresher and direct them to some of these courses. As you've been chatting, Sonia, I've also been looking up these courses at Olds, and I'm wondering, do you know if they offer any of these online?
The veterinary course actually was online, and I think they're the only school that's I can't remember if they took it away now, because they had the veterinary, sorry, they had the animal health technologist course online for many, many years, but a couple schools took it away because I think it was just becoming too much information. Because it is a lot to take in. Like even with me going to the college, it's a lot. I honestly, I'm not too sure at this point. I know one girl was planning on taking it this year, so I'm thinking it's still offered, but I'm sorry, I can't give you a for sure answer.
Oh, no worries. I can look it up too. I just thought you might know offhand, but thank you.
I would think it would be a little difficult to do it online, would it not? Like, would you not want kind of the hands-on if you were taking the program?
Yes, and the program when it was online, because there was two girls that I know that I previously worked with that did it online as well, and they do they do have you placed into a clinic as you're doing your course, so that you can be doing all this stuff like holding the animals a certain way, collecting blood, and then you have to do some time at the college for, I think it's 2 months that you actually stay at the college, and you have to do the blood collection, you have to do like surgery they have, or you do videos. I know a girl that went to, I forget the name of the college, Caribou College, I think in BC. I could be wrong on the name. I apologize. But she went in BC and she had to videotape everything that she did to show them how she did it, so that they could see the exact technique that she used.
Did you say that you had to stay at the college for the last part?
Yes, you have to be there for, I believe it's 2 months. And that's so that you can show them how, like, your actual technique rather than through a video. Because sometimes you can do it a few times and videotape it a few times, where this way, when you're actually at the college, they see you do it that first time.
So just for clarification, when you're saying you had to stay at the college, are you actually living in residence there, or are you just attending full-time there in person?
For my, for myself, when I went to school, or for other people?
Anybody?
Okay, it would just be that you're attending full-time. You don't have to live in the residence. If you know somebody in the town or the city, yeah, then you can stay there. But it's just full-time
Okay.
at the college.
So you really stress the volunteer stuff at the one part here and stuff. What type of volunteer opportunities are there within the, let's say, a clinic to a boarding stable?
Okay, so yes, volunteer is important because, like, if you're looking to get into the animal health technology course, it's mandatory. Uh, it's part of getting into the course, so you need it. Uh, and pretty much anywhere. There's a few places. I know that there's a couple of girls that worked at Save that I know. That's in Okotoks, the Southern Alberta Veterinary Emergency.
Yep.
They do have volunteer work there. They will take volunteers there as well. The only thing right now with the COVID restrictions, that's part of the problem right now, is clinics can only have so many people in the clinic at one point now. So I guess volunteer is a little bit harder.
What about, I know that Monday to Friday or Monday to Saturday would be really busy kind of thing with people coming in, but what about on Sundays and stuff where there's limited people there? Is there opportunities for people to come in and, let's say, nurturing the dogs or walking, animals after surgery? Or
Yeah, for us, we're not open on Sundays. We're also a smaller clinic, so we usually only have 1 to 2 animals staying in the clinic at one time. So my role is I'm the veterinary technician, plus I'm the tech assistant, plus I'm a receptionist, and so I play all roles in the clinic. I but I we would take volunteers as well, but with being such a small clinic, we're not allowed to have numbers over a certain amount right now with the restrictions. But in the future, we'll be doing that. And for Sundays, if you went to an emergency clinic, if you called them and just asked them if they were taking any volunteers, they probably would take somebody on to walk animals. And that is a way to volunteer as well, to just walk animals. Or even SPCAs, they take volunteers as well, to take the animals out as well.
Oh, so it doesn't necessarily have to be in like a clinic setting or like a vet, like it could just be.
Yeah, if you volunteer at the SPCA, because they do have their own clinic there as well.
Mm-hmm.
So if you volunteer there, it's still being around the animals. It's not specifically like for doing like your volunteer hours. Like you worked at a like with horses, and you worked at a horse vet, but you were only working in the stables rather than actually in the clinic area. It should be considered as a volunteer work with that.
Okay.
So, but if it's an independent barn where it's not recognized, then no, that would just be like your own volunteer work then.
Okay.
It would have to be something that's recognized.
I had another question as well. So you work in a clinic now,
Yes.
but you mentioned that you had worked in a more like agricultural setting.
Yes.
What would you say the pros and cons of that would be, that type of work?
Okay, so that's a really good question. When I first got out of school, that's what I did was I worked in a farrow to finish barn, it's called, and I really, for myself, yeah, you get used to the smell because pigs are not exactly very clean animals, but but and they smell a lot. But at that time, the pay was really well. It was better than a clinic setting at that time. Now it's the opposite, but yes, it was really good there. It depends on how much physical work you want, because I find at the barn there was a lot more physical work than at the clinic. But I do a lot more technical stuff in a clinic setting. So I guess it depends on what degree you want to be like going. If you want to be like just working with one specific animal, like if you're working in a barn, it'll be either be with cows or with pigs or with horses, because they're not going to have them all in the same barn together. Where when you work in the clinic, yeah, you have your cats, dogs, and you can expand to something with exotics if you wanted. So there's a lot of different routes that you can take in a clinic setting.
I was
just
actually,
really- Oh,
sorry, that was my other question. I'm interested in exotics as well, like particularly reptiles. Is that like a separate type of course that you would have to like add on, or
No,
no?
no. You learn a little bit about exotics as well in the animal health technology course. And then going into, like if you got out of school and you went into a clinic, you could apply for clinics that have exotics and they would teach you a little bit more. Being a technician, we have to get so many continued education credits, it's called. So we have to go to so many conferences a year to get those credits. And you can go to any kind of conference that you want. It can be on exotics, it can be on anything, and then you learn even more about that specific species.
Okay.
Yeah, so you can branch out once you're out of school.
Okay, I like that. So you're kind of like always continuing your education
Yes, yes.
to be able to hold your, I guess, license?
Yeah, it would be like a license, yes. We pay for it every year as well for an association. And yes, we have to get like, it's called 15 credits. So every hour that you spend watching a video, but it's all about, like, we used to go to conferences until COVID. But if you go to a conference, you would sign up for so many things, and you can sign up for, like I said, horse information, or cows, or cats, dogs, exotics, anything like that. And you would just sit through the lecture, but you have to have 15 hours of learning something new.
Okay.
And it's a lot of fun. I like learning new things about the animals and just keeping up my training.
Hey,
Did that help?
Yeah, thank you.
if
You're
somebody were to apply at a vet clinic, Sonia, like similar to that lady from Australia, like, is it you that helps out with doing the interviewing, the screening, or is it just all done through the vets?
It's a little bit of both. They will, like, the veterinarians will look at it, but they will ask me because I'm going to be the one more working with them and training them.
Okay, so with that stuff, what do you see volunteers or job seekers and stuff putting on their resume or cover letters that's gonna stand out and grab your eye kind of thing?
Well, if they're looking for a volunteer position so that it can help them for school, then I definitely would say to put on there that you would like to do some volunteer work to build your skills in the veterinary field, just so that you can, so that somebody knows that that's something that you're very interested in.
Okay.
And then
Then
or mentioning that you'd like to go to school and this is what you'd like to see, because myself as a technician, I knew for years and years since I was a little kid, this is all I wanted to do, was to work with animals. That's it. I didn't mind any of the stuff, the blood or pee or poop or anything. It was all just the animals. So but you learn more about if you really want to be in the field when you volunteer.
okay.
And I do apologize that my camera's not working.
They didn't teach you that in school?
Yeah, they didn't.
No, I'm just kidding. Does anybody else have any other questions for Sonia or?
Nope, I have nothing.
Sorry, I was muted. My one other question was, I guess, job availability.
Okay. There is, from every veterinarian that I talk to, there is a shortage of technicians in Alberta. There's a lot of people, oh, I guess that's one thing I didn't mention. A lot of people don't stay in the field of being a veterinary technician. There's a few different reasons. One of them is that you really need to like your job, because it's not really super high pay, but it's not minimum wage, but it's not like making $40 an hour or anything like that. So you're not going to be rich, but you gotta love the job is what it comes down to. The other reason that people go out of the field is that it can be demanding on the body, depending on what field you go into, whether you're doing something physical like working in a barn setting, or with horses or cattle. They can be a lot more physically draining on your body. And I've seen a couple people with very bad knees now, or people have been knocked out from horses, so they don't work in the field anymore. So a lot of it can be just physically. Some of it is mentally. Like myself, I am just I'm the technician and the tech assistant. I play a lot of roles here. So some days I go home and I'm very, very tired because I played three different roles at times. But it's my love and passion for the animals that keeps me in this field. Because that's what it's all about.
Cool. Good.
I hope that helped.
Yeah. Do any other questions, guys?
This is just like oh, sorry. This is just kind of a random self-care question, I guess. Is there any like formal support offered within the field for those hard days when you're seeing a lot of animal neglect or abuse, or just having to put animals down, stuff like that? Is there any formal resources that you can access in the field?
There are. I haven't used any myself. I just I guess I've done a lot of self-care for myself, so I will I just know how to try to keep myself happy, what makes me happy. So I try to focus on those things on those days that are really hard. I but there are resources for it. They also have courses for that as well through the field, which are considered as continued education as well. It's just for self-worth because we all we all try to do our best like with those animals, and like you were saying about the putting them down, yes, with euthanasias, uh, that can be pretty hard on a person, especially like myself being in the field for 16 years. I was at a clinic for 15 of those 16 years, and I saw the animals as puppies and then have to say goodbye to them because it is a short life. Because your smaller dogs, they'll live. Uh, Now the people are taking better care for them. They're living to be 17, 18 years old now, the small dogs. But the big dogs, yeah, we're still seeing like 9 years if we're lucky. Yeah. So that definitely is a hard part of it, and uh, that was one of the reasons we had to cancel the last meeting that we had scheduled. Was a very, very sick animal.
Okay.
Would you say that for like your job specifically, do you have to have pretty good like people slash communication skills?
Oh
Probably.
yes.
Yeah.
Oh yes. Yes. It, you have to have that compassion, and compassion just isn't from myself. Compassion isn't just something that you can pretend. I it's just like when you go into a store or somewhere, you don't want people to treat you poorly or to talk uh, harshly or anything towards you, because we're there for the patients. A lot, and you have to deal with people that get really upset with you because they're upset because their animal is sick. So you have to be able to control the situation, because we have had clients come in that will start yelling because they're really upset about their animal. They're not thinking about how they're talking to us, but they just I will just say a lot of things that if you don't kind of put up a border, yeah, it can get out of hand. So you do definitely have to be able to talk to people, to not get worried about what people say, because like I said, it's their animals that are hurt, and a lot of people can't deal with that properly. I and I guess that's not the right word. Properly is not the right word, but they just have a hard time dealing with it that their pet is upset. So yeah, definitely people skills is a big part of it. And making people feel welcome too.
Yeah.
Yeah.
If any of these guys has any further questions, like at a later time, are they able to either contact you or send us a question and we can actually send it on, or?
Sure. Either one is fine. I will admit I am the worst person at replying right away, and I look at it and I think about it. Cal knows this because I look at it and I think about it and I'm like, oh, did I do that? Because yeah, staying busy is my big thing.
Cool.
But yes, I will, and I will answer it. Just sometimes it might not be immediately.
Okay, great.
Mm-hmm.
So last chance, any questions, guys? If not, thank you very much for coming, and thanks very much, Sonia, for all your sharing all your knowledge and skills kind of thing and stuff, and being so open about that. So
Okay, well, thank you guys for inviting me and for coming to this, and I hope I helped you. And sorry about my camera.
hey,
Okay. Thank you,
All good.
Sonia.
Thank you.
You guys all stay healthy and take care.
okay, we'll
You
see you
too.
guys later.
You.
Thanks so much.
Bye bye.